Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Opening Doors to Empower Victims of Interpersonal Violence, presented by Betty Goodwin, Emergency Department Clinical Nurse Specialist with Washington Hospital Healthcare System. Before we begin our presentation with Betty, I would like to introduce Jennifer Dow-Rowell, Executive Director of Safe Alternatives to Violent Environments, also known as SAVE. Jennifer has dedicated over 2 decades of experience to addressing critical issues related to gender-based violence and homelessness. Jennifer is here today to tell us more about SAVE and the services they provide. Please welcome Jennifer Dow-Rowell.
Hi everyone, my name is Jennifer Dow-Rowell. I'm the Executive Director at SAVE. And since 1976, SAVE has been the sole full-service provider of care to survivors of intimate partner violence and their children, based right here in the Tri-Cities. Our services include 24/7 crisis hotline, a drop-in center where people can come in and get immediate assistance, a safe house, housing support, and community education, including youth services, to help prevent violence from happening in the first place. SAVE would like to remind our community that if you're experiencing intimate partner violence, you are not alone. SAVE is here for you, and we are proud to partner with Washington Hospital. Thank you.
Thank you, Jennifer. And now I would like to introduce Betty Goodwin. Betty has been a nurse examiner for over 15 years and coordinates the sexual assault team and recently implemented screening and referral for human trafficking victims who present at Washington Hospital. Please welcome Betty Goodwin.
Hi, my name is Betty Goodwin and I'm the Clinical Nurse Specialist in the Emergency Department at Washington Hospital. I'm going to be talking to you today about opening doors for victims who've experienced interpersonal violence. First of all, what is that? It could be anywhere from physical violence to threats of violence. It can be sexual in nature or psychological in nature. And any form of those kinds of violence constitutes what is lumped under interpersonal violence. Why should you care about this? Well, 1 in 3 women or 1 in 4 men experience some type of physical interpersonal violence during their lifetime. And about 1 in 5 women and 1 in 13 men have experienced some sort of sexual violence by an intimate partner. The other thing that's in this category is human trafficking, which is becoming more of a subject lately. And in our area, as you know, we have several airports and a local transportation system, which makes travel easy among the communities in this area. So for the cases of last year, it was 1,500 or so cases of human trafficking, and that was just in California alone. It's pretty important for you to understand your community and kind of the variation of race and population that you have. Obviously, the 3 cities are somewhat different in their makeups, but it's important to know what surrounds you and which populations are more vulnerable than any others. Washington Hospital serves the communities around us. So in that aspect, anyone, regardless of their race, religion, sex, gender, education, socioeconomic status, can and may be a victim of interpersonal violence. Everyone needs safety. Victims require nurses to be trained in trauma-informed care and proficient in screening. Therefore, every nurse that is onboarded to Washington Hospital Emergency Department gets the SOAR training for for health and wellness. And we also have a specially trained group of forensic nurses that make up our Sexual Assault Response Team, or SART. These are 7 highly trained ED nurses who serve as liaisons in the department for anyone experiencing domestic violence, sexual assault, human trafficking, to provide a safe and supportive network to the nurses and the victims of this kind of violence. The SART team response has 24/7 coverage. It's culturally competent, meaning the nurses are trained in the cultures of those populations that I showed you. Evidence collection and forensic exams are part of the services that we offer, as well as nursing care, and we are part of a multidisciplinary team, including the physicians, law enforcement, advocates, social services, and local community resources such as SAVE, which you heard about. Our community service and education also goes out into the community and does things to educate the public. We've done concerts in the park where we've taken blood pressures and educated the public on safe teen dating. You see there the group of nurses who are receiving a DAISY Award for their work in forensic nursing. How can relationship violence affect your health? This is most important. While physical violence can cause physical injuries, stress of this kind can also cause serious problems. These kinds of things would come out as eating disorders, trouble sleeping, depression, anxiety, or mental health disorders, such as panic attacks or suicidal ideation. Post-traumatic stress disorder would occur after experiencing any kind of violence and can be harmful to that person. They would have trouble trusting people and developing relationships, and you might notice them imbibing in alcohol or drug use to the extent that it's detrimental to their health. Why do I point those things out? Well, there's some things that we can do to prevent intimate partner violence. One of them is just to be aware of your surroundings. I don't know what kind of line of work you're in, but depending upon what you do, if you're a social worker, a teacher, law enforcement, there are some things that you can be aware of as well. So watch out for the signs. In addition, if you're in those roles, you can also help by leading by example. Perhaps if you have an influential role in a boys club, you can volunteer and set those normal examples. There are also things that we do here at the hospital, like creating a very protective environment by constantly improving our policies or our workplace climate to provide a safe environment for people who do experience violence in their life. We also support the survivors that come to the hospital by increasing their safety and creating less harm. And by this, we use victim-centered care. We have some programs through social services which can help, and we also refer to our local services in the community. And that creates a network for people experiencing this to come and get the services that they need. By doing this, we hope to share empowerment, increasing the capacity of individuals or groups to make choices about what they want and to transform those choices into desired actions and outcomes. It's a good quote because that's what we try to do here at the hospital. We are hoping that we can empower people to live their best life and be healthy, and we welcome them to come to the emergency department if they're experiencing any type of violence and need assistance. Thank you so much for tuning in today. Would there be any questions?
Thank you, Betty. Yes, we do have some questions. The first question is, what can someone do if they suspect someone is a victim of trafficking or interpersonal violence?
Well, I think that's a good question. And the first thing is recognition, right? You need to be aware. And if you're feeling that this is a symptom or something that you have and you've experienced and you would like help, please come to the emergency room and let someone know. that you'd like to speak with someone about this problem. We are safe in our environment, and you can also contact your local law enforcement as well.
Okay, thank you. And the last question we have is, what if someone is afraid their abuser will find out they are seeking help? Are there assurances of confidentiality if they come to Washington Hospital?
You know, that's a really good question to ask, because a lot of times people are afraid that they will be found out and that they will experience more harm by seeking help. And so what I want to assure people is everything at the hospital is kept confidential. We make sure that we have your consent to make any contacts that we need to, and all of our providers keep your records in confidence. There would be no way that there would be any leaking of information at all.
Thank you. It's nice to know there's a safe place. And this does conclude our program. Thank you so much, Betty, for this insightful presentation, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.